happy to be presenting today's session, and it's a really important session today around climate change, housing and homelessness. And I don't need to tell anyone that it's probably, or it is, the biggest threat facing humanity and obviously our ongoing chance of surviving. Our news feeds have been filled with devastating impacts on housing of climate change from around the world and close to home. And in fact, I spoke to someone just before we came in about their roof getting ripped off last night. But what about the social determinants of health that we often don't see reported in the news? From Esperance to the Kimberley, the housing we provide for people can directly impact their health. Issues such as mould or a lack of heating and cooling opportunities, poor insulation, lack of ventilation, crowding, these issues must be addressed as climate change threatens to worsen in the not too distant future. And for people who are experiencing homelessness, the changing climate can cause heat stress and sometimes lead to death. So how are we preparing for warming climates, more adverse weather, such as flood, drought, higher temperatures, and what can we do to ensure that people who are sleeping rough or sleeping poorly in social housing are cared for appropriately? So let's run through the format today. It's a little bit, we have to maintain a little bit of pace, and I may just cut people off and keep people going to make things work. The first session, today's broken up into two sessions. The first is really a focus on climate change and homelessness. We're going to hear from Professor Petra Tschakert, who's a researcher in climate change, adaptation and resilience at Curtin University, and then Professor Lisa Wood from Notre Dame University, who will speak to the effects of climate change on rough sleepers and the incredible work she's been doing. I'll hand over to Lana, who will facilitate a workshop. For the people on Zoom, we're going to break you up because there's so many. We're breaking up into two, I think, is that right, Royston? Two separate breakout rooms, which will be facilitated by John. Four. Hang on, four. We've got a lot of people on Zoom. We're going to put you in 4 rooms online, and then I don't know who all the facilitators are, but you know, we've got a lot of staff at shelter, so there'll be someone facilitating one of those breakout rooms. We'll have a short break and come back for a second session. The second session is around climate change and housing. And we've got Grace Dudley from the Kimberley Community Legal Service, who's joining us from the Kimberley via Zoom. David Jones from the Department of Communities, who's their Chief Sustainability Officer. And lastly, Professor Paul Torzillo from Healthabitat, who's also the head of respiratory medicine at Royal Prince Alfred Hospital. He's been a very busy man since COVID hit our shores. Is attending remotely from Sydney as well. And then we'll have a second workshop on those effects, in particular around housing, social housing and the effects of climate change. So that's the format. Pens at the ready after you hear these talks. I'm going to introduce Professor Petra Tschakert, who will provide a snapshot of the science of climate change, and she should know she's an IPCC author, and in particular the projected impacts specific to Western Australia. And as we adapt to a new climate, the kinds of considerations that we would need to focus on as decision makers around homelessness services and homelessness providers. So thank you, and Petra, welcome.
Thank you so much and good afternoon. Me too, I would like to start with acknowledging the traditional owners of this land, Whadjuk Noongar people, and I pay my respects to their elders, past, present, and emerging. So I don't have the slides in front of me now. Thank you. All good. So yes, I will kick us off with what we should know on the climate science front. And I want to start with some key definitions that we need just to be clear what we're talking about. And particularly, I want to make sure that we know how we place vulnerability or structural vulnerability in the talk about climate change. So this is one of the probably most iconic pictures from the IPCC. And what we should know is that the climate part is on the left and everything which is socioeconomic processes is on the right. And what we talk about very often is risk, and risk is composed of the hazard, exposure, and vulnerability. So I'll lead us through here. So hazard is any potential occurrence of an event or a trend and the harm it causes, right? So the possibility of a hazard, like the triple whammy we have seen over the last couple of days, that's a hazard. It may occur. Exposure is, well, being in the presence of such an event, right? Being in a location where it may occur. And the presence is of people, of infrastructure, of assets, and being in the presence means we could be harmed. That's exposure. But most importantly for us, we need vulnerability. And vulnerability is defined as the propensity or predisposition to be adversely affected or harmed. It is often a function of susceptibility and sensibility, but also a result of low capacity. Right? So these are the three elements. Very often we hear, oh, people are vulnerable to climate change, which is actually an incorrect framing. And more dangerously, it distracts from the structural vulnerability that we need to work with. In this particular case for today, we're talking about extremely structurally vulnerable people. Yeah. So these are the aspects of the concepts I'm going to use. What does that now mean in the context of people who sleep rough and people who experience housing insecurity for us in WA? So the hazards are, in addition to air pollution, heat waves, cold snaps, droughts, storms, fires. We know that much. Exposure, not too difficult either. It is simply living exposed to the elements, having no shelter whatsoever, living in inadequate housing that has no insulation, for example, sheltering in areas that are prone to floods or any other hazards, and most importantly, in the context of heat, the heat island effect. You know, densely built up areas with little tree cover or canopy cover, in addition to all the heat that is generated by AC that we more privileged people have access to. Now, on the structural vulnerability front, we have the structural vulnerability that is baked into our society, combined with individual vulnerability. And you can see a whole list of elements that cause vulnerability. And I suppose we're all familiar with those in the context of homelessness, ranging obviously from socioeconomic disadvantage and poverty, entrenched, pervasive poverty, and various dimensions of inequality and discrimination, that may be racial discrimination in the context of finding housing, domestic violence, losing homes, energy poverty, not having the resources for cooling or heating, all the way to social isolation, and something that I'm particularly interested in, and you see that at the end, sacrifice zones, or what we call climate gentrification, meaning, well, in areas where people have the resources to adapt and to build up their resilience, very often that means property prices go up and people can no longer afford the infrastructure in the neighborhood and hence are pushed out in areas that are actually becoming more resilient, which is hugely problematic. The consequences, the impacts are also a whole suite of things, from obviously exacerbated health outcomes, heat stress, frostbites, anything from hypothermia to hypo to hyperthermia, anything that exacerbates food insecurity, water insecurity, not being in places where water is publicly available, an increase in infectious diseases, waterborne diseases, but also more substance abuse, potentially more violence in homes or in areas where people live, especially if they're overcrowded, also in shelters, right? So this is the dynamic we're dealing with. And I suppose most of us are familiar with that. Now let's take a look at what we should know about the future. What I just shared is what we already know, what people already experience. So I show you a couple of graphs too, and then some numbers, so we have a sense of what may be looming in the future. So the first one is, it just simply says hotter compared to what we all know today. So if we assume a 2-degree warmer world on average, compared to what we know from 86 to 2005, so that's most recent, yes, it would be warmer over most of Australia, particularly the center. Fine. If we take our year or the period of comparison further back to the time our grandparents would have known, it's much hotter. And actually, we're already getting into 2.5, 3 degrees warmer in certain parts of the continent. Now, I've been on the IPCC for long enough. I've seen many of these graphics. If you don't like to see any of these graphics anymore, here's a simplified version. This is what it means, right? But this is still assuming a 2-degree warmer world on average. If we look at the forecast, at the projections for WA, we have to prepare ourselves for something more extreme. So this is the most pessimistic outlook, if you want, from a climate projections perspective. That's RCP 8.5, worst case scenario. So for parts of WA, we have to prepare ourselves for a 3-degree and possibly 5.5 degree warmer world. It's not just a 2 global average. And let's wrap our heads around that. If we want to count the number of heat days, usually what's used is more than 35, more than 40 degrees. And you may remember the 13 days above 40 that we had this past summer, which was a new record, fair enough. But you see the numbers here from now, 4 on average, that's the long-term number of more than 40 degrees. We had 13. But in the future, the 13 that we experienced will possibly be remembered as one of the coolest years, because we have to prepare ourselves for 20 to 25 by 2019. I let that sink in. Okay. And number of days above 35 degrees, well, possibly more than 70. And that is quite dramatic. Another way to wrap our heads around what is looming is to think about climate analogs. So what would Perth, what would our neighborhood look like by 2050? Well, it would be roughly 2 degrees warmer. So more or less, if we live close to the beach, more or less like the climate today in Jurien Bay. A 4-degree warmer world for Western Australia means a climate reality that we now know in Dongara, right? For those of you who have been up north, that means something. We can expect more intense rainfall events, just like the one we've been through, longer, more intense droughts. In the forecast, there isn't anything that speaks to an increase in very cold days. They will not increase, which doesn't mean they won't happen. It doesn't mean that they won't be severe. If we want to look at specific locations, here's the first one. This is Broome. Number of days above 40. So we start out with what you see to the left, which is kind of the current average, which is more or less like Perth. But by the end of the century, with the climate policies currently in place, hopefully this will change soon, but with the climate policies currently or up to now in place, the number of very hot days above 40 could climb up to 62. That's Broome. If we count hot days above 35, and I don't know if you can read the number, 286. That is scary. If we go to Fitzroy Crossing, and if you look at the number of nights above 25 degrees, so anything above 25 is not really comfortable to sleep in, it goes up to 220. And now if we think about these expected number of days and we overlay them with the shortage of social and affordable housing, roughly by 2035, 2036, it was in the news yesterday or today, we can start to imagine what that would look like. Now, what do we do about it? Most of my work has been on adaptation pathways. And what you see is a drawing that we have put together with participants in 2J. And I'm not sure if you can see the details, but in essence, it's a pathway between now, 2030 and 2040. The yellow ones are activities the community could undertake with support from the government, care from the government. These are wordings put together by members of the community in 2J. We would have climate rescue, and we would have a good life for all. If that doesn't happen, if the care from the government, so they say, does not fall into place, what we would expect then, already by 2030, not 2090, 2030 is a societal breakdown and a climate catastrophe that would lead to kaboom, right? By 2030. This is not far away. So what do we do about it? Adequate housing, it's a basic human right. We need standards for climate proving, so not just better insulation, we need better circulation of air, standards how to build, ensuring that at least there is a fan where circulation can happen naturally. We can talk about the details, retrofitting, which is desperately needed, well-targeted alerts. How do we reach people currently who don't have a permanent home? How do we reach people who live in cars? Many of them don't have a cell phone. Many of them don't have an app. So how do we do this appropriately? How do we think about health action plans or heat action plans? I'll show you an example in just a second. Shelters that need to be accessible, not only for people who experience domestic violence. We need to think about disaster transportation. If there's an event like the one today, how do we get people off the streets and into a fair and safe place? We need to include people who know exactly what they lived through in disaster planning, in heat action planning. We need pro-poor urban planning policies, not anti-poverty policies. And we need energy, health, justice related research. I have one last slide. Am I good in terms of time? Here's a heat action plan as an example. I'll be quick. This is a thermal inequality map from the city of Joondalup. And what you can see is that on the same day, on one hot day in February, it's actually not equally hot across the city of Joondalup, right? So the red areas are those that have over 45 degrees, whereas the blue are 10 degrees cooler. So what do we need? We need to map, I'm a geographer, I like mapping. We need those thermal inequality maps for all homelessness hotspots. We need to overlay them with greenness indices to understand where there is sufficient canopy cover. We need to overlay that with location-specific vulnerability indices that include, obviously, diverse socioeconomic strata. We know Aboriginal Torres Strait Islanders are particularly vulnerable here. And we need to locate where the existing or planned social housing and other forms of subsidized housing are in these areas, how they overlap with the priority list, how they overlap by the by name list. And then what we do, and that's my last one, we need to think about strategic cooling and heating refuges. You know, where would people go? Where they're strategically placed? Can we open up public spaces for cooling and heating above a certain temperature threshold? Can we liaise with caseworkers? Can we work with them to reach people? Potentially update when we have extreme events like the ones we saw earlier this week on the by name list. Can we offer 24-hour services for people so they don't die on the street? And can we establish an outreach mechanism that go beyond, as I just said earlier, cell phones, and that allow us to reach the most vulnerable? So that's my starting presentation. I happily hand it over to Lisa for more details.
Thanks, Petra. We're going to hear from Professor Lisa Wood, a tireless advocate for research being relevant and useful to the real world. And she's recognised nationally and internationally for her leadership in homelessness and health fields. And she's leading a growing program of collaborative research and evidence-led advocacy, strongly anchored around priorities identified by services working at the coalface of homelessness and people with lived experience. Thank you, Lisa.
So disclaimer number one is that I am not a climate change expert, but I have lots of experience in public health. So it's a high priority for the Public Health Association, which I'm a part of. And obviously today is really looking at the intersect of homelessness and climate change. And really a lot of what I'll be talking about is from the lived experience perspective, both people who are experiencing homelessness and also frontline services, both here and some examples over east of what we might be able to do about it. So I do pay my respects to the traditional owners and custodians of this land and their elders past, present and future. And I think this is particularly salient when we know that homelessness is overrepresented amongst Aboriginal people and the impacts of climate and climate adversity are also overrepresented. And just to acknowledge also some people that have helped me put this together, kind of went out to the streets and bailed up busy people on the phone and other things to really ensure that I wasn't just giving you my opinion, but giving you the views of people who are living through it or trying to support people through this. So first off, the old school kind of quiz. I know lots of people would have you doing something on your phone now, but just have a look up there. There's 10 things in your head. Just tally up how many of those you have ready access to. Anyone score below 8? Below 9? Okay, so now imagine you're sleeping rough. This is a laneway in the CBD when I was out with the street health nurse last Friday where some people had spent the night. You're not going to be ticking any of those things. So I think it was really fantastic to listen to Petra and I think just there's the big picture aspect of climate and climate change and our concerns about it globally. We all kind of have our own personal concerns and impacts, but I think they're even more acute if you don't have a home to shelter in or if you have substandard housing. And some of the things I'm going to share are from my colleague Simon Quilty in Northern Territory, who I've done a bit of work with on this kind of area. This is really his thing. He's a medical doctor who's, I was going to say obsessed, but doesn't sound right. But anyway, very passionate about climate change. And this is from a town camp he took me to outside of Katherine when I was doing some work up there on a health justice project. Until the health justice lawyer intervened, people were actually being charged rent for these terrible, terrible tin huts. One of them was lived in by a lady who was having dialysis. And it was so blinking hot under the tin that they just moved their beds outside. And so what I'm going to do now is really, I'm going very basic compared to presenter number 1, and I've kind of divided up into hot, wet and cold. And the reality is that in any of those scenarios, you can't escape it. So all of us know what it's like on a hot day where you feel a bit hot and bothered and hopefully if you're healthy, your sweat kind of kicks in. But body temperature regulation is really hard if you don't have access to water, shade, being able to get out of the heat. So I think that's a huge issue. Dehydration, sleep, your recovery from illness, skin cancer, the list goes on and on. So I think just there's those immediate physiological effects of heat and being exposed to it. So this is a case study from some ongoing work we do with homeless healthcare, and I happened to be out with Nat, one of the street health nurses, late last year, and she was bandaging the arm of this man who I've called Kevin for today's purpose. He had to have a skin graft because of a cancer that was removed. He'd been living on the street for 5 years. He was often sun exposed. He hadn't had access to skin cancer checks and so on. So by the time it was picked up, he needed major surgery, skin graft, and then he was still on the street getting his wound dressed. He's housed now though, and doing really well. But that's the kind of thing that I guess we can easily take for granted. And this was a comment from Simon about people living in that town camp, and the lady here, she's got a fan there trying to cool down, but the electricity cuts out, and that's been part of his research, looking at, that the kind of a terrible irony that the people who are most vulnerable to the effects of heat and high temperatures also sometimes rely on electricity that then cuts out when it's hot. And we know that many people who are homeless have higher prevalence of chronic health conditions anyway. And so then that's further exacerbated if you can't regulate your body temperature or you can't keep your meds correct temperature. So this is a case study from my colleagues in St. Vincent, Sydney. So they had, they actually, I'll talk a bit later, but they actually have a protocol that kicks in if the weather is forecast to be over a certain temperature for a certain period, which is fantastic, except that as Matt Larkin was saying to me, sometimes, particularly in the climate change era, you get a freaky hot day that no one had predicted. So that's what happened late November 2020. It was 44 degrees, lots of people in the ED at their hospital and elsewhere coming in for heat exhaustion. And at his hospital, that included 3 people that had been homeless. So one man had been at a food van in the park, lining up to get a meal, collapsed, had a cardiac arrest. His body temperature when he came in is 42 degrees. So if you think about how we've all become a bit more kind of savvy and paranoid about body temperature over COVID, and, you know, and you'll start to get twitchy and alarmed when you're over 37.5 or whatever. So 42 degrees, ended up in ICU for a week. So an ICU bed at Royal Perth Hospital is estimated to cost around $5,000 a day because of the intense nursing care. So you can support a lot of people who are homeless just for that one person who ended up in ICU. If you think about medications, so some medications have to be in the fridge, like insulin, and Jonathan shared powerfully yesterday about how his insulin base didn't work because he was out in the sun. And a lot of other medications require it to be kept at below 25 degrees or similar. So again, how do you do that if you don't have a house, you don't have a fridge? And in that case study, I talk about a man who he'd been in and out of hospital for diabetes. It was just getting worse and worse. And his discharge notes, literally, because I got to see them, said that he should use insulin 4 times a day and store it in the fridge. And yet he was discharged back to the street. So go figure. And then Simon, because he's worked up in the kind of more tropical areas, introduced me to this notion of mango madness, where he said that, you know, when particularly that hot, humid weather and just the effects on mood, and there's a whole kind of research science about that. So, you know, that's another thing. And I think even for many of us here, you know, it's easy to feel a bit grumpy when it's hot. And then Simon's been doing a lot of work with this wonderful Aboriginal elder in the Territory, Norm, who, and I've put the article there, but he has written about how in the olden days, I guess, you know, they would spend time on country and they would know the water areas and where to go to keep cool and the shade and so on, and how that's kind of just been eradicated as the environment is kind of degraded and as the climate changes. This is my only kind of graph and it's very basic, but really I guess just to say that, you know, there's a whole lot of things that, as has been outlined, increase people's risk if they don't have a home. So I don't know, does anyone, you know, if you live in Perth or you drive down Wellington Street, quite often in the past, not so much now, you would see Aboriginal people under the trees. That's a really normal thing for Aboriginal people to do. You know, if you go up to Broome or any other place, that's how they like to socialise and spend time. And a lot of the people there would be down from country to go to Royal Perth Hospital or with family. That's all being kind of gentrified now, and particularly when they were gentrifying it, there was a big fence around it. And so people relocated to the cactus, which is like the antithesis of shade, even though it's meant to look like a plant. And I've been out with a street health nurse on hot days where people are sitting around the cactus doing their thing that they would have done under a tree, but it's blinking hot on that pavement. So wet and cold. So we've talked about the hot weather, I've gone to the cold, and then I'm going to tell you a little bit about what some other places are doing to respond to this. This is one of the probably the first time in my life someone showed me their missing toe, and then I got the beautiful story about how his foot had stayed wet for a very long time in a wet sock, in a wet shoe, and he was totally wet because he was living on the street. And so it went gangrene, and I'll spare you the details that I got, but you know, that led to an amputation, not once, but then he had to go back into hospital again for that. So And when I was at UWA talking to a professor in podiatry, he goes, oh, we kind of like working with people who are homeless because it's the only time my students ever get to see trench foot. Trench foot, which died out well, I thought this was in the war, but he said you still see it. So, you know, that's what we're talking about. This is a lady who let me take a photo of her trolley last Friday. She was trying to shield her stuff from the rain. And I chatted to Lance and Heather, a couple of the outreach workers at St. Pat's this week, who were telling me just, you know, they said, I would be shocked about how often it happens where there's people on the street who've been in hospital for pneumonia or a respiratory condition. They've been discharged, they've got some antibiotics. You know, they're lucky if they can hang on to the antibiotics, often they're stolen or they get lost. And then lo and behold, they're back in hospital again. And it's really hard to get well. And we know the health system is under pressure, but it's really hard to get well if you're put back into the very circumstance that potentially made you sick in the first place. And in research and data that we have been working on for Department of Health, we see that the number of people presenting to hospital in winter with respiratory, flu, pneumonia is higher amongst people experiencing homelessness. And you'll see that comment down there at the bottom about it's not just that you're out in the elements, but it's also if people are congregating in communal spaces. And I guess we're very acutely aware of that over COVID. So again, chatting to the outreach workers at St. Pat's, it was really interesting for me where they said it's not just a weather thing, because what they observe is that a lot of, in the summer, people can sleep out on the beaches, but when the weather turns yuck, they look for shelter, but that often means that you're then less in public view. And so there's a whole safety thing. And I was talking to Gloria about that. So particularly vulnerable for women. So, you know, they might then find kind of verandas or deserted buildings. And then the outreach workers were telling me, well, then there's sometimes legal implications. So they get trespassing notices, or people are not really sleeping because they're just kind of watching their back the whole night. So I think this kind of ripple effect, this intersect of weather, health, but then the other kind of inequalities and adversity that people are experiencing. And yes, so we've had this shocker week. And I think what I've really been thinking about and talking to some people about is that it's brought home to me that your life is so unpredictable and you've got so little control and agency when you are rough sleeping. And we have a, you know, we all believe in person-centered care, but that's very hard for the person who has no belongings and nowhere to stay and is at risk of getting moved on at any minute. And so I think, to me, psychologically, the fact that you have no control over the weather or even getting yourself out of it is a really potentially traumatizing thing. And I'm a big pet lover, as people know. In fact, it's the part of my research that I'm more known for. And so I guess it seemed a terrible irony this week. And I loved that RSPCA was concerned about pets in this weather, but it got heaps of media. And on that same day, I had found out St. Pat's was staying open, and I was kind of looking, was there anything in the media about people who are homeless? No. So there was stuff about getting your dog and your cat out of the rain. And we see that in summer as well. So what does that say about us as a society? So these are just some quotes from when I was out on the street last week. Someone who, she said she turned 50 on the street. Now she's about to turn 55. She's been on the priority list the whole time. And again, she made that point about in summer, it's not so bad, but winter you're trying to find shelter, but then you might get moved on if you've just found somewhere that's dry. And one man that I spoke to recently at the Medical Respite Centre told me that he would just layer inside his clothes and his pants with the West Australian, I assume, which is not very comfortable, and certainly I can't really imagine that making you much warmer. And then obviously in our upper part of Australia, we have, it can be wet but not cold, and then there's that risk of infectious diseases and skin diseases. And I deliberately didn't show you any photos of those. So then really, I just want to finish now with, you've got these kind of hot, wet, cold, but what can we actually do about it? So there are things that are being done, and I knew about the South Australian one. I've looked into a bit. So they have, they actually have, it's across the state. there's code red and code blue. So it's activated by some algorithms linked to Bureau of Meteorology data, and they're in a code blue, a lot of areas of Adelaide at the moment. And that means there's some extra money that kicks in from government. Michael, so your ears could prick up about that idea. And then, but also word is out there. And I think, you know, so then everyone knows that if the temperature is of certain high or low for a prolonged period, then places stay open longer. Caseworkers and things, people are on the lookout. There's a single number that people can call if you're concerned about someone. And so, yeah, South Australia's in a code blue at the moment, and have refreshed that just recently. St Vincent's Hospital has been working with a local council and some other homeless organisations. So they have their own policy. It started off around heat, but they're also very mindful of the colder weather. And so it, again, an algorithm which I didn't quite understand, but they've shared it to me and I'm going to pass it on to Michael. But so that, again, if it's something to do with the lower minimum and the high temperature, and you add them up and divide it, and then you know that, okay, this is going to be a difficult period for people. And so it's everything from the homeless team from the hospital being out there with water, sunscreen. They know the places that are open, places like libraries and so on, with air conditioning, encouraged to not move people on. So it is possible, but nothing like that in Australia that I've seen. The UK, so obviously lots of media about the heat wave, and I did have a giggle when I saw that their kind of severe weather protocol kicks in when it's 32 degrees. So obviously we're a little bit tougher in Australia, but it's looking like it's going to, you know, it's going to get worse and worse. So again, across all of the UK, they have this severe weather protocol, there's guidelines, local council, homeless services working together to put things in place. So these are some examples from hot, and then the same thing when it's cold. So we don't have to reinvent the wheel, we could do it. Northern Territory, so this is the house of Norm, the man I was sharing earlier. So he and Simon have done some amazing advocacy about getting solar panels onto public housing roofs, and it's been rolled out to 10,000 public housing because people were having their fridges and things cut out, and then they, you know, so you've got people with health conditions and their medicines going off in the fridge and so on. So I think that's been really amazing, and I'd love to see that happening here. And then I really love this kind of quote when Norm was asking what do we need? And it's not rocket science, and it takes me back to when I was doing kind of some urban design health stuff. You know, he just says, you know, in his hometown, he'd like shade and proper houses and water fountains and power so that people could be warm or cold, and shady places that older people can sit down. It's not complicated what he's asking for there. What's been done here? So St Pat's, very excited when I found out on Monday, because I had this talk coming out that they were opening up because of the weather, and I went down there and I got asked if I wanted to stay the night. So obviously I look quite bedraggled from the rain. So not so many people Monday night, but Tuesday night, I think as word got out, they had 21 people, and Michael shared with me, including a mother and a young son, and then 12 people last night. And I was chatting to some of the staff down there, and also one of the folk who stayed there Monday night. And I really felt that there was a sense that even if no one came, symbolically, it was really powerful to say, you are not abandoned, you're not forgotten. So thumbs up to St Pat's for that. Also, homeless healthcare. So their street nurses, whether it's hot or cold, they're kind of particularly on the lookout for people. So when we were out on Friday, they had blood pressure monitor and stuff, so someone was concerned because they've been out in the rain all night. And they will provide some basics like, you know, thongs, and one of the nurses run off to the Good Sammy's shop to get someone a coat because they were freezing. And Nat made an interesting comment to me because she said, and I've noticed this as well, there's not a lot of water fountains around in Perth. And so, you know, that's again something that's not hard to provide. And apparently they got turned off in COVID, so then the nurses would be lugging around these water. And so finally, just to finish, to say that, you know, climate change is also a cause of homelessness, and we've seen that with the floods in Queensland and New South Wales, and also bushfires. So we've got to have that thing kind of going hand in hand as well. And so I think for me, this was from a report a few years ago that came out about climate risk, but it anticipated then that there is an inequity in climate risks and exposure, and homeless people were mentioned. And I think for me, just to conclude that above and beyond the actual effects of climate and climate change and on health, it's that the fact that it reinforces how little agency and control people have over their lives. And I really feel that we want to fight to change that. Thank you.
No, just head back. That's great. And I think if you're online, there's a number of people who are, and people starting to put some questions in the chat. If there are questions for Lisa or Petra, and you are online, very happy to put them in the chat, and we'll make sure we go and have a quick chat to those guys and get it out there on the chat in response. I've got a proposition for us all, which is to give us another 10 minutes by not having a cup of tea and wee break at 2:14 as per the schedule, but to do it during the workshop time. If you need to do either of those two things, do it, and then we can roll straight into the next session. Does that sound okay? If you're at home, same for you. So that'll get us an extra 10 minutes, Lana. You'll be very glad to hear. I'm going to invite Lana up. There was just one thing that I think would be useful in relationship to both of those presentations, which is interesting, I thought, is that when we work up north, we tend to focus primarily on the wet bulb temperature, which is an indication in a sense of human survivability. It's a relationship between temperature and humidity, and that number is actually a lot lower than is often quoted. I mean, I've worked in temperatures outside of 50 degrees, and you can survive if it's dry and you can stay hydrated and cool down occasionally in air conditioning. But once the wet bulb gets to about, well, let's say 35, but in most cases 32, human survivability is almost nil. And so actually in the last couple of weeks, we've seen a number of places across the world with wet bulbs in the 35, even just for a period of several hours. And that's certainly happening in the north of Australia as well. So it's in some ways less an issue around some of the things that we're talking about, and just the very simple fact, can humans survive that kind of temperature? And the answer is no. So now for the fun part. I don't know if there is a fun part in this kind of conversation, but this apparently is, according to my speaking notes, the fun part. I'm going to get the audience to think about that, and I'll get Lana to run us through our first workshop. Thanks.
Recognising that our fabulous speakers did speak for a little longer than we had anticipated, I'm also proposing that we're going to truncate this section. So what we're going to do is 10 minutes of discussion on question 1 and question 2. So for the wonderful people in the room, you've got your questions in front of you on a sheet of paper. Could I suggest to you, given the fact that we're going to have to move through this really quickly, if you've got things that you want to say that you don't think we're going to have time to share in the joined up discussion, can you just write them on the sheets of paper, please? So Shelter WA is preparing a communique as a result of this week of activities. So we want as much information from you as we possibly can share. And for the people online, could you please write, if you've got a piece of paper next to you, write down your thoughts, take a photo, send them through to Shelter WA, write them up and send them via email, whatever mechanism works for you, but please get your thoughts and reflections into us as you can, as much as you can in this truncated time. So I facilitated a lived experience workshop a couple of weeks ago. My participants were amazing in terms of just writing away while we were having the discussion, and that information was incredibly useful. So let's do that. So can I flag with you that the first question, if you look on your sheet, is focused on rough sleepers. And it's about how well do you think the sector stakeholders and WA government are currently responding and preparing for the impacts of climate change? So the key words are responding and preparing. So what I'm proposing to do is I've got this continuum here. As a group, I encourage you to reflect, where are we on that continuum? Is it being done very poorly at the moment? It's not being done very well, but that's the continuum. Now, I invite you not to go straight to very poorly and just put a tick there. Can I encourage you just to have a quick conversation about it? Because I know, as Lisa has just reported, there is amazing things that are being done. So where are we on that continuum? That would be really good for Sheltered WA to say, we undertook this consultation and our very diverse group of participants all thought it was being done incredibly, really, really badly, or somewhere on that continuum. So when you're in your groups discussing, and in here, if I could invite one person from each table to take on the scribe role, please. So we want to hear where you are on the continuum, and then some comments. So some comments to reflect where you think you are on the continuum. The next question is focusing on, so if you look at question number 2, what should be the priorities for improving our collective response? So that's across everybody. What are the resources that the sector need to do this? So what are our priorities? So up on the whiteboard, you can see I'm going to record some priorities, and I'm going to record what you identify as the resources that are required to progress this. So because we've got 3 groups here, we've got, I think, about 5 groups online. Make your conversation as extensive as possible, but can you land on just a couple of points? Because we're not going to have the time to hear any more than that. So a couple of points around priorities, a couple of points around resources. When we come together, I'm going to write these up on the whiteboard as a collective statement of your discussion. Is that clear for everybody? Good instructions, we're all good to go? Okay. It's 5 to 2 now. If I could ask you to have as intense conversations as you possibly can in the next 10 minutes, and I'll pull you together at 2:05. Okay, thank you, and go. Okay, people, I'm really sorry that 10 minutes has gone incredibly quickly, hasn't it? Okay, I'm going to be really quite directive here because we do need to hear from groups and we've got limited time to do this. So I'm going to be quite, start at the other end. Oh, right. Okay, could I invite the scribe from this group, please? Yes, you looks like you've been dobbed in. I'm really sorry about that. Hi. Okay, can I ask you two things really quickly? First of all, where would you put yourselves on this continuum? I've been helped by this group and I've actually put some numbers on. So just to start out, would you tell me where you think we are on this continuum and then a couple of key comments?
I had to turn the mic on. That It's on. Okay. Right. Where are we on the continuum, guys? Well, I started saying very poorly, but we've actually improved on that. And there are some plans underway, we've heard. So what would we say? Probably halfway along, 4 to 5?
4?
Yes.
I would suggest that it's actually really hard and almost inappropriate to try to map a response over this, because what we see is that some regions are doing particularly well. So that the South Metro is doing a plan around this work, and other South councils are coming in and getting involved. However, we don't know what's happening in other regional areas. They may be doing something similar or they may not be. So it's not, I don't think it would be appropriate to say we're doing okay, because we don't really know how well we're doing, and we need to take a place-based regional approach and analysis. And then we also need to actually draw out all of that great stuff, map it so that we can then get inspired by it and then begin with a baseline.
Okay, beautiful. Okay, can we move to this table? Thank you so much for that. Moving to this table, are you willing to place your group somewhere on the continuum?
I just wanted to respond to Leila. So that's great, but where's the government policy that they're nestling into?
Hi. Sorry, what was your question about
So
where we're going
are you willing to
like
plot it somewhere? Yeah.
So our group, we were the difficult ones, and we actually said there was a different discussion for responding and for preparing. So our number for preparing
Right.
is 3.5.
Yep.
And our number for responding is 4.5.
Right. Okay. So the message is starting to be heard, but we've got a long way to go in terms of actioning that.
Yes.
Beautiful. Any other comments that you would like to share?
The comments around preparation were questioning where the funds go, because there isn't a strategic policy for climate change, and let alone that takes into account then homelessness.
Yep.
And that also climate change just isn't even discussed openly in the public discourse. So we need to start there, and we need to also start bringing homelessness into that discussion. And in terms of resourcing, our concern was similar about localised responses rather than.
All right, so we haven't got to that one yet. We just.
Yes, sorry, we went a bit.
Yeah, I'll come back to you on that one. Beautiful. Okay, this table here, were you willing to place yourselves anywhere on the continuum?
We're the pessimists of the group.
Yep.
So between 1 and 3.
So down here,
Yeah.
1 to 3. Is that,
and
it's probably a bit further than that, probably there. Okay, but that's pretty pessimistic.
well,
Yeah.
And our reason was because the reactions are, it's responsive rather than proactive. Like when there's an issue, when there's media coverage, when it's, oh, this is a problem, then stuff's done. But it's like those stats that we just saw from the,
Yep.
you know, it's already at the point where we need to do something. But so we need to be a bit more proactive.
And we need to engage community broadly in that discussion, don't we? So we need that information we've just been shared. The community needs to know that, and currently they don't, is my humble opinion. Anyway, moving to our online groups, Daughter, are you willing to share where your group is at? And I'm not sure whether daughter is going to be on the screen.
Sure. So can you hear me?
Yes, loud and clear.
Okay, great. Okay, so we were quite pessimistic as well.
Yep.
So we were sitting down the lower end of the scale, and mainly there were a couple of key points that came out. One of
just
them
before you go
was-
to your point, sorry, are you willing to give us a number so that we can plot this?
I guess we'd probably be sitting around the 1 to 3 mark as well.
Same.
For our group.
Okay,
Yeah.
beautiful.
And so one of the things, again, was very much about the essence for us was very much about being very reactive and not and in our responses. But a really important point was made about the the level of housing quality in general, in terms of responding to climate change, just as a general sense, without not even considering homelessness and the provision of housing there. So as a whole community, we need to see an improvement in our housing standards and insulation and all those sorts of things to mitigate some of the impacts of climate change. And obviously, if we do that, that'll improve for people who are renting and who are in state housing as well. The other one was in terms of the heat impact and the rain and wet impact for when we moved from Wellington Square to Moore Street, there actually isn't a lot of shelter at Moore Street. So the impact there has been quite significant. Like in the last couple of days, they had to try and find tarps and things for people. So again, there wasn't a lot of planning or preparation in terms of that move made sense for some reasons, but there wasn't a lot of thought in terms of the impact of the weather and climate and how that was going to impact on people.
Beautiful. Thank you so much, daughter. Mel is in the second group. Mel, are you willing to plot your group's response on our continuum?
Yeah, for sure. So again, we're pessimistic, and I'd like to say otherwise, but I just can't.
No.
We recognise the response is there. It's well known. We're all a part of it, but the plans, they just lack the preparedness in our eyes. We had a bit of a regional lens on it as well. There was a few of us from regional WA, which was really good. And we see the bigger issues. We are also impacted by the fires and extreme weather with heat in our areas. And we can see it's reactive. It's everyone's saying the same thing, it seems. So sorry, I'm repeating things, but yeah.
Oh, no, it's great.
Yeah, it's very reactive. Resources seem to be there for a short-term solution, but there's no long-term outcome. There's a fire in the area. We know how to fix that really quickly in the sense of supporting a community. Money gets quickly thrown at it, but they're all just short-term fixes. Yep. And when it comes to rebuilds as well, there's no sustainability. So the preparedness moving forward, it's not there.
Beautiful. Thank you so much. That's fantastic. Sustainability. Okay, and finally, Rose, are you willing to locate your group on the continuum somewhere?
I would probably struggle to locate us because it was 2 of us, and we don't either of us work in homelessness. We're more in the housing side of things.
Right.
We were, hesitating a guess that it's on the very low end.
Right.
But we also, both of us work really closely and predominantly with Aboriginal communities,
right.
And in regional areas. So we were just talking a lot about the need for, like, it's reactive, and that it seems to be a one-size-fits-all that's developed for the white community in metropolitan areas. And so the need for funding towards locally led community responses that are tailored to our really diverse regions, and even within each regions, there's still a lot of diversity in climate and the impacts that increasing climate change can have on those areas.
Yep, beautiful. Thank you so much, Rose. So I think we can see there that collectively we are at the very poor end of the continuum. And I think it was really interesting. There's so much consistency in the responses, focused on the fact that the responses there, particularly if media focuses on the issue, otherwise it's reactive. What we need is the proactivity. All right, let's move on to the second question now, which is really looking at what we need to do to progress a collective response. So that's the sector, key stakeholders, WA government, local government, everybody. What do we need to do to move this forward? And hopefully we'll see some consistency around the priorities and more particularly the resources. So what do you need to progress your agreed priorities? So I'm going to come back to this group first. So who's going to be the spokesperson? Oh, here you go.
Okay, so we had lived experience voices, like that qualitative data like Lisa brought. So data, linking to data and houses for all. So we kind of couldn't separate between those as priorities. That's right.
Mm-hmm. Yes.
So can I just tease that out a little bit? So you're talking about the importance of the lived experienced voice. Ah, sorry, I got the wrong one. Okay.
It magically appeared.
It magically appeared, all right. So you're talking about the critical importance of the lived experience voice, and then you were talking about the data, I think. So you're talking about the need to share that data broadly.
Well, and collecting the data, but as it was evidenced by the data that was shown before, the value add of the actual qualitative, the actual stories of people with a lived experience of homelessness. And then we've also got in between that housing for all, the collaboration between the sectors. So health, energy, homelessness, housing, mental health, families, the intersex of people's individual lived experiences cannot be separated. This voice needs to be an equitable part of the solution. And at the moment, people with a lived experience are not. And our sectors are divided. So it's in those individual lived experiences that these silos and the sectors can collaborate and work together, but we do the top-down sector division rather than the individual person. And there's pockets of this stuff being done. Climate is not necessarily included, but if we look at our First Nations, if we get it right for our First Nations, for First Nations people,
yep,
then we'll include climate, we'll include individual, we'll include family and community. But yeah.
Okay, so
is that teased out enough?
Yes, it is teased out hugely. But without wanting to minimise what you're saying, I'm hearing loud and clear it's the lived experience voice that is going to be key in moving this issue forward so that people get to hear what it's like, as we heard from our two speakers today.
That is definitely our voice, but there were,
yep.
As a person speaking,
can you use the mic? So
as a person speaking from lived experience, yes, they need to listen to us.
Yep.
Not or their meetings. Meetings are fantastic. Administration is what I do for a living, but stop talking, put it into action.
Yep. Okay. All right. That's beautiful. Thank you. Can we move to this table? Oh, you need a mic. All right. Okay. Beautiful.
So I'm only talking about priorities, right? I won't get carried away. So we've got policies, that those policies actually need to be strategic and I would say based on lived experience. And also those policies should be drawn from strategic plans. So yes, that goes into the one thing there. Campaigns as well for raising public awareness. So it actually becomes politically expedient to do something. And I'll leave it there. So I
Yep,
don't
no,
start
that's
going to
great.
resources.
Excellent, excellent. Okay, moving around to the next table. Priorities.
Doing a few things at once. Are you now scribe?
Well, we didn't have a chance to talk about.
Oh,
that.
right, you didn't get, I know, there's not much time, is there?
Well, so just to reinforce what everyone else said, the intersector collaborations are super important.
Yep.
That's actually going to reduce systemic risk, which is really important. Also asset mapping and capability mapping. So having a look at what's strong out there and what needs support and what we can do to scale that support and capability up, and gap mapping. So we know, because there's going to be finite resources, where we need to invest.
Yep.
We also need to find where we can find the resources to invest. So the NDRR grants and the Preparing Australia grants are about to come online. It'd be really good if we all had projects to put in and get a grant funded that way as well, in addition to government responsibility.
Beautiful, fabulous. Daughter, can I go to you, please? What priorities did your group identify?
So we had a couple linking to the last one. We talked about improved housing standards to mitigate climate change for the future. We really like the red and blue code, so some sort of warning system that preempts funding and action. So like implementing some sort of system like that, putting that into place. So in terms of housing, so looking at an audit of what all the empty rooms and buildings that are around and how we might be able to use them in different ways, and to make, but also on a bigger scale, considering housing not in the hands of a few. So looking at negative gearing and taxation and housing availability. And I think just lastly, in terms of the comms and a campaign approach, I do think climate change is very much front and centre at the moment. It's on the political agenda. So I think there's an opportunity there. And I think really to highlight that lots of people were previously working, had a stable home and housing, and then because of climate change, we now currently have a whole bunch of people that are homeless, and that actually is the future if we're not going to take action. I think there's a moment now where we could capture that and really get Australians on board.
Yep. So there's real momentum, and the opportunity to build on that momentum. Beautiful. Thank you so much. And Rose.
Hello. I want to reiterate everything that everyone else has said, but I thought I might say the bits that we have that are different, so you can expand on your list.
Yep.
We talked about physical, social and emotional health priorities being a focus, which would naturally lead to addressing homelessness. We talked about locally led responses, as I mentioned before, and leveraging the Closing the Gap agreement and implementation plan, which has some specific mentions about homelessness and housing. And then the other one, which we took it right back, and we were talking actually about discrimination and prejudice. Don't know how you fix that, but as something of a priority, because we know that not only influences the way that people experiencing homelessness are received by their communities, but also those implicit biases seeping into government and funding bodies, and then therefore towards, I guess, solutions and resourcing that comes out of that.
Beautiful. Okay, we're going to do a quick round now because we're rapidly running out of time. Amazing list of priorities. What resources do you need as an individual, an organisation or a sector to progress this? So I'm going to start at Michael's end because I know Michael. Michael, you can do it. Come on. So we're looking at what resources do St. Pat's, the sector, the broader community, what resources do we need to progress all those incredibly important priorities?
Look, I mean, certainly for the type of response we've been providing that was discussed earlier, there is, unfortunately, to do it properly, there is a cost involved. So financial resources, and I guess also resources around planning. And look, unfortunately, I was out of the room while that discussion was going on, but really a need for place-based planning to take into account the different needs across our community in our state, being able to map to understand what we've got available, where the gaps are and how we deploy, and resources around the connection to the Bureau of Meteorology to really guide those responses as well effectively. So they're the things that come off the top of my head. Yeah.
Great, you did really well, Michael. In fact, you know, if you look at this list, we've actually got some of the resources already identified, because some of the groups came up with asset and capability mapping, gap mapping, improving housing standards. So actually, I think we're well on our way to understanding what resources we need to move forward. This group.
We had our priorities and resources flow on from one another. So
of course,
what was needed to actually progress those priorities. So in terms of the policies, there actually needs to be the funds for the infrastructure, the things like solar panels and insulation and improved building for that to actually be implemented. So the strategy should actually guide the funding.
Yep.
And funding for local research, funding for strategic plans to be regularly updated as we become more aware of the impacts of climate change over time, and also funding for the services in both those categories of responding and preparing.
Yep.
So that we're not just having a knee-jerk reaction and scrambling.
Yep.
But
it's done in a planned and sustained way. Yep.
Avoiding unnecessary harm. Yeah, minimizing harm.
Yep,
yes,
beautiful.
Because disasters are caused by humans, not natural.
Yeah, absolutely. This table.
For me, if we look at the economics data that shows that it's actually more economical to house someone than it is to actually keep them on the streets. And the ripple effect of having someone housed with wraparound services, we know from the data, shows that people actually heal, they start to get well, and with that continued support. And so we just need the funds to go into the bricks and mortar with a focus on having houses that actually are appropriate to the Australian hot climate and the supports for the people who live there. So it's about prioritising the social housing and all the other types of housing as an economic long-term solution to all of it.
Yes. And that's the challenge, isn't it? So that the cost benefit of housing people is, I think, there. The problem is that that's a long-term strategy. It's not a short-term one. Yeah. Okay. My reflection on that. Yes. Sorry. Yes.
I was just another thing that we started with a dollar sign and a picture of a person, because it's like people, power or money. And interestingly, everyone else said money first.
Yes.
So just to advance on the people power, like making sure that the people who are doing, like when we're talking about campaigns and get like policy knowledge and climate knowledge and all of that, that we've got people who are knowledgeable about the issues and the aspects of those issues, including the
lived experience. Yeah.
I'm a broken record.
Yeah. No. So it's about having. I'll just put that down here. It's the partnership of the experts and the lived experience, isn't it? No. Oh, right. Okay. All right. Yeah. No. That's what I understood you were saying. Yes. So put the lived experience first and the expert second.
just building upon that, we need widespread investment. People need to genuinely care about these issues. It can't just be in isolation. It can't just be a field of experts or a field of people with lived experience who are the experts who are investing in this issue. It needs to be widespread, which is why the public awareness campaign is going to flow into that resource. It's going to generate the opportunity for us to actually have that as the key area.
Beautiful, thank you. Can we go to our online people, please? Daughter, do you have any particular resources that you want to add to this list?
I just wanted to add, I think someone mentioned data, but yeah, really important to have the data, you know, so for example, for local governments, if you're talking about a place-based approach, you know, local governments really need access to good data so that they can actually plan some of those responses, and often they don't have the capacity to get that kind of data themselves. And also thinking about local governments, so really emphasising the climate and health aspect, climate change and health, because all local governments have to have a public health plan for their communities. So it's a no-brainer. Once we get that link in, it's actually one of those things that they'll have to take action on if we build that in. So I think that's a really important component of that. And that was, the others are pretty similar to what everybody else has said.
Beautiful, thank you. Daughter Mel.
Hi, we got skipped with the priorities, but I left that in the chat box so you can record that later.
Oh, I'm sorry, Mel.
That's okay. I don't think you have enough room on your whiteboard anyway, to be honest.
Rapidly running out.
That's okay. Again, everyone's kind of hitting it on the head, so I'm just going to be saying the same thing, but lived experience obviously is a priority. It's asking me to start my video. The resources we have need to kind of stop focusing on the short-term solutions. Obviously short-term's crisis and we need that, but we're not looking at the long-term solution as much. You know, we've got about 100 rough sleepers here and we've been promised 11 houses, and you know what I mean, like it's just a quick short-term fix for a small cohort. It's not long-term solution. More money, that's it, just more money for long-term
solutions. That beautiful. Thanks, Al. And finally, Rose, anything else? Rose, we've got a lot of stuff on the whiteboard. Is there anything in your group that you discussed in addition to what we've got on the whiteboard?
The only thing I would probably put in addition from our perspective is that such things as like research and strategy and implementation should be led by ACOs or community controlled organisations.
Thank you. That was my point. That was my point as well. And I've been holding the microphone, but we were hoping that as well. I mean, thinking of Aboriginal community control. So I agree with lived experience. You are like, people are the experts. And so I think it's really important to put the money in the right hands about people making decisions for themselves in the space. And I mean, that's in line with closing the gap and with all of the things that we all sit in this room and know need to be done. So.
So I'm going to stop it there because, no, sorry, Michael.
Housing is next. We're doing
housing is the
housing
next
now.
session.
So we'll have another opportunity. Can I just do a very quick summary of this? I think very clearly everybody is saying that this work needs to be resourced. And we need to see people with lived experience as the experts, recognising these amazing experts in this room, and engage with community via the public awareness campaign. That seems like the very strong message that's come from this. We're running way behind time, so I'm going to hand back.
There goes your bonus, Lana. So thank you. We're going to keep rolling and go into the next session. We've got 3 fantastic speakers on the next session around climate change and housing. You'll be pleased to hear, Michael. It's all about housing, this session. So first of all, we're going to welcome Grace Dudley from the Kimberley Community Legal Service. She's on Zoom and she's going to share findings of a new report that's examined the lived experience of social housing tenants living in the Kimberley. So to Grace.
Hello, can everybody hear me? I'm assuming yes. Thank you for having me today. And thank you to Shelter WA for organising all of these great events. I'm speaking from Mirrawong country in the East Kimberley in Kununurra today, and yeah, I work at KCLS, Kimberley Community Legal Services, and we're a non-for-profit legal service. We provide holistic legal, social and financial support to clients, and a lot of our work is tenancy focused. We assist people with legal advice, with maintenance, repairs, requests, all that kind of stuff, and also financial counselling. So we see the side of the difficulty of paying for power bills and stuff like that. And so we've commenced a systemic change project on lived experience of housing, in particular the lived experience of public housing tenants in the Kimberley during periods of extreme heat. So that's a bit of the background, and in the Kimberley context, I guess, in terms of climate and housing, it's really hot up here most of the year. As you can see on the slide, it's hot for over 200 days a year in Kununurra, over 35 degrees. And there's lots of research to show that temperatures over 35 degrees have really serious impacts on health and well-being if you're exposed to them for long periods of time. CSI, RO and BOM research shows that the climate's only going to get hotter up here. And so it's a really important time to start thinking about changes to the way we address housing in this area. Other important facts, there's a lot of renters in the Kimberley and a lot of public housing managed by Department of Communities. A lot of those tenants are Aboriginal and Torres Strait Islander people who experience higher levels of preventable diseases and chronic illness, which is often highlighted as a result of poor housing standards. It's also expensive to live up here and homelessness rates are really high. So with all of that in mind, we completed a consultation with 15 tenants in the East Kimberley. We did a survey and we spoke to service providers as well. As you can see, we did it in late 2021 when temperatures were usually about 40 degrees or higher. So lots of themes coming out of those consultations, and we really just wanted to hear the lived experiences of tenants on the ground. The main themes coming out of it were tenants feeling like their housing was not up to scratch, maintenance issues and overcrowding, leading them to find it difficult to control the indoor temperature of their housing. On top of that, tenants were experiencing what we might call energy poverty, finding it difficult to afford energy, and that was reinforced by the current cooling policy, which means that tenants have to purchase their own air conditioning, which puts financial pressure on them. And finally, all of these factors lead to the lived experience of tenants indicating that the health and well-being of their children and their families were affected by the heat. So the next slides are just quotes from the lived experience of tenants that we spoke to, but I'll go into a little bit more detail about those themes that I just spoke about. So in terms of housing quality, a lot of tenants spoke about the fact that they felt their housing wasn't built for the climate or for the community, which is kind of what people were touching on in the workshop before. Not a lot of consultation with the Kimberley or communities within the Kimberley. It's very diverse up here. It's very different to Perth or anywhere else in WA, as you can probably see from those heat maps. Tenants also felt that maintenance issues that were not being addressed on time, such as holes in the walls, cracks, unrepaired doors, windows, that really contributed to them being unable to control that indoor temperature effectively. And finally, and probably most importantly, or most obvious was overcrowding. It really wasn't uncommon to find, you know, houses with over 10 people living in them, and for families to sleep in the same room at night where the air conditioner is. And obviously there's a lot of research that shows the more people in a house, the harder it is for a house to stay cool, and the harder it is for an air conditioner to maintain a good level of thermal comfort. And as we mentioned earlier, the homelessness rate in the Kimberley is 9 times higher than Perth. And overcrowding also leads to poor environmental health, and it's harder to keep houses in good condition. So that was a major finding. And then, as I spoke about earlier, a lot of tenants worry a lot about being able to afford power in these periods of extreme heat where it isn't really an option to go without. And if people do, it's obviously very adverse to their health. So during the build-up and wet season, which is September to April, really hot period of the year, energy and water use goes up, and tenants are stuck in a bit of a cycle where by having to purchase their own air conditioners, but being usually quite financially vulnerable, they're not able to afford high quality cooling appliances, which in turn costs them more money. And it's here this lady is speaking about her bill being $300 to $400. Other times we spoke to tenants whose bills were up to $2,000 or $3,000. And so that obviously puts tenants at a real risk of disconnection. And disconnection obviously has really serious impacts on health, access to medication, access to refrigerated food, and puts pressure on other housing, leading to more overcrowding. And finally, the third theme that really came out was tenants really speaking about the impact of these factors of their housing not being of a high enough quality to deal with the increasing temperatures, of their bills being really high and relying on inefficient, ineffective appliances is a really high impact on their lived experience of their health and well-being. And so I've added a few stories up on these slides, and it's in line with a lot of other research which shows that exposure to extreme heat is really detrimental to health and well-being and to mental health as well. So some of the feedback from our consultations in terms of physical health were lots of people reported their children becoming more sick, and elderly people were finding it very difficult to cope in the heat, difficulty sleeping, and that's due to temperatures not going below 25 degrees. Scientific research shows that temperatures below 25 degrees, your body can recover, but above, they can't overnight. And lots of people spoke about the impact of the health and well-being, impact of the heat, on their existing illnesses. So things like this lady had a lot of difficulty managing her epilepsy, and basically stayed inside all day, despite the fact that her air conditioner doesn't work particularly well and her house isn't able to keep the heat out. And then that's more physical health side of things, but also we found that a lot of this extreme heat period had an impact on people's social well-being and ability to participate in the community effectively. For example, a lot of service providers notice that their staff who are in public housing don't show up to work as much during the hotter months of the year because they're dealing with sick children or they haven't had a good night's sleep. Other people or tenants spoke about feeling less safe at home because they have to keep their windows and doors open overnight if they're not able to adequately cool down their house with an appliance. And then the biggest overarching theme was just a feeling of stress at a personal level in terms of feeling like they don't have any control over the quality of their housing, over the amount of electricity they need to use, and just the the toll of heat stress day to day. And perhaps also importantly is the stress of the community. So there's increases in antisocial behaviour and crime and things like that. And so all these factors could really be alleviated a little bit by providing a more thermal comfort in a home and more homes in general. And so these are our solutions based on our consultations, based on those lived experience reports from tenants. Obviously, the overarching one is to consult more with the local community, but these solutions we think will solve some issues in the short term. So providing energy efficiency air conditioning is obviously something that will assist now, but the overarching solution to really address the warming climate, the health impacts of inadequate housing and the climate is to address overcrowding and improve livability of housing. So that's our report.
Thanks so much, Grace.
Sorry.
Excellent. We're going to just keep going, and but don't leave your desk. Stay there. I'm going to invite David Jones from the Department of Communities, who's the Chief Sustainability Officer and is responsible for managing the department's climate action and sustainability team, moving towards its net zero greenhouse gas emission goals, reducing utility costs while achieving better comfort outcomes for tenants, all the things that Grace has just been talking about. So he's an urban planner and designer with over 20 years experience working in government and development industry. Welcome, David.
Thank you, Kieran, and everyone else that's been speaking today. Firstly, I'd also like to acknowledge the Whadjuk Noongar people on the lands on which we're meeting today and pay my respects to elders past, present and emerging. First of all, you probably know who the Department of Communities is. We're big. We're here, Child Protection Family Services, as well as the old Housing Authority, Disability Services Commission, the old Regional Services Reform Unit. So we cover a whole gamut of things, and including 36,000 plus public housing properties. That's increased over the sales and the builds over the past 12 months, as I'm sure Minister Kerry told you when he spoke. What we're having to do is an additional 3,300 homes to start off with through purchases as well as new builds. So my team, we're new. Chantel would know that she's been speaking to me since I started. So there's a few of us now. One of the things that we are doing is preparing a climate action and sustainability strategy, which will guide the whole agency. That's big, that's challenging, but it's also enlightening at the moment. And it's going to provide us the impetus to actually do exactly what Grace was saying before. So that's going to apply to not only our homes, but also our service delivery, our corporate operations. It's no good us, just putting energy efficient houses if we don't, walk the talk ourselves as an agency. And the big one there is resilient communities. And that's something which is so important with climate change. And we have the net zero target, as everyone else does. The building industry building is recognised as one of the easier ones in our state to achieve. So that's something that we're embracing. So there's a lot we need to consider as an agency. First of all, the UN Sustainable Development Goals. Wasn't talked about much before, about 2 years ago, and then it's really come to the forefront for this government, which has been great. COP26 has really raised the bar, and the new federal government's 43% emissions reduction. Some say it's not enough, but gosh, it's better than what it was. So that I'm really happy about. Trajectory for low energy buildings. That's actually been something that's been going on in the background for a number of years, and something that was agreed to by the former COAG, that we would all head towards lower energy buildings, which has now been shifted to net zero. So I'm part of our working group, national working group, where we're looking at national minimum rental standards and looking at rating all government agencies rating their buildings. I could probably tell you what a lot of ours rate right now, and we're well aware of that. So that's going to be really interesting, and something that will hopefully get, if government's saying, well, this is what our properties are and this is what we're doing to raise that level, hopefully the private sector will come on board. And as government, it's up to us to lead the way. So the state government's commitment of 80% emissions reduction from 2022 levels for 2030, that's great for us. That's for government agencies. So for us, we're looking at that with our social housing stock as well. We've got the WA climate policy. We've got the WA climate change risk management framework. You might not know about that one. It's not publicly released, but us government agencies have to look at that. And it's based on the New South Wales system, which is looking at, okay, any major asset decisions, what's the impact of climate change on that over the life of that project? So that is really starting to open all our eyes, and Treasury is behind this as well. So that's fantastic. So that's really setting us in the right direction. We've got our waste avoidance resource recovery strategy, which is also Department of Water Environmental Regulation and Water Authority. Sorry, I've got a lot of things I've got to report to, and our Waterwise Perth Action Plan. Now that for us applies across the state. We base it on Perth, but applies across the state, and I'll talk a bit more about that one. So our build program, our housing minister probably went through it all with you. I'm not going to go through that. It's on the presentation, but we're spending the most amount of money that we've spent in a long time. We've got a lot. We know that there's the huge wait list and there's catching up to do, and we're working our way towards it in challenging construction markets. Everyone knows what they are, but we're still working hard there, and that does involve spot purchases as well. It's not all about new builds. So one of the challenges we face is we can't do one size fits all because we've got such a bloody big state and we've got so many different climate zones. And when I talk to my Eastern States colleagues and I show them this map, they go, wow, my gosh, we've got 3, you know, and we got so many. And that's the thing, you know, we were talking about the Kimberleys there. I was in Balgo 3 weeks ago and it was freezing. So, you know, we can't do just one size fits all for the Kimberleys. We've got to look at each individual climate zone. And that's something which at least NAFAS does help us look at, focus on individual climate zones. I will say, and we'll get to this, that we don't necessarily apply it to climate zones 1 and 3 as such, because we have to design for the cultural requirements as well as the, you know, making that last longer because it's so hard to get people out there to fix things. So, you know, we got to make robust housing as well. So that's something that we've got our own separate design guidelines for there. That it was a co-design process on that with various community groups as well. So we are doing some 100 rapid built timber frame homes. That's to get some on the ground. The challenge is there if you're trying to hit, you know, various NAFAS ratings. Albany's a bit different to Perth. Perth's not too challenging to hit 7-star. Albany, you've got a few more things you need to do and it costs a bit more. So that's been really, really interesting for us to learn as an agency. And also probably one of the biggest things, and some of the things that we've really changed our viewpoint on over the past few years is affordability doesn't stop when you hand over the keys. So that's something that we really try and look at now is what's the operational cost for here for our tenants and our maintenance costs. So we've got to look at it from both perspectives. So our current standards as of now, our water-wise fixtures and fittings are above the minimum level of national construction codes. With Water Corp, we've raised that. You can see the 4-star wells, toilet suites, and 3-star wells, shower roses. We're easing into higher than that, but so 3-star wells is 7.5 to 9 litres per minute. People often pull out the restrictors from the shower rose if you go any higher. But also it's also about behaviour change and education. So with this program, we've provided educational material as well to both our housing service officers and our tenants, and we've had a great outcome from that. 7-star NAFAS for social housing. That was we put that on board October 2021. 618 homes have been, that's as of today or yesterday, designed and are in the process of being built or have been built to that rating. Now that's designed to, the NAFAS doesn't test afterwards, after it's built. So that we'll be doing, yeah, I'll be very interested to know, you know, how it goes with the end build there. It turns out that there was a bunch that were being done before we started mandated this, and because if you design it, it's not that difficult. If you design it 7 stars, it's not that difficult. If you're trying to change off the plan, it's much more difficult. And we've also been doing silver livable for since 2018 now for all social housing where possible, where practical. If it's on a steep sloping site, you can't necessarily hit that, but the internals are still done to that. It's funny, when we're doing affordable housing as well, we just focus on social housing now, but when we're doing affordable housing and we're selling to the market silver livable homes, it's funny, the first home buyers were going, oh, I'll have this because it's wider, you know, when you walk in, it actually looks nicer, feels nicer and all that sort of thing. So that was a really good learning experience. So just as a bit of a side note, if you're going to hit 7-star, the sky's not going to fall on your head. If you design it right, we found that one that we did in Kiara, where one of our internal architects designed a home to 7-star timber frame, didn't cost us any more. And we got a great price for it. That was an affordable housing product 2019. And yeah, it sold really quickly. And so, but if you're not designing from scratch to 7-star, then on average it's cost us an extra $4,300. Albany, it can be more. And once again, in the Kimberleys, you've got other things to consider as well. So yeah, the costs there are, we haven't got some accurate data on that at this stage. So what else are we doing? We've been working with Synergy over the past 18 months, putting solar panels on 500 homes. That's in so Synergy is in the Southwest Interconnected System. We're talking to Horizon at the moment. They'll be looking at the remote communities. There's Horizon are working through various towns to increase the capacity for solar as well. And with the state government's emission reduction requirements, they have to look at that. So we're working in collaboration with them. 10,000 public housing dwellings being converted to waterwise. It could be more. We're basically, the mandate is that no public housing tenant will be adversely impacted by inefficient water fixtures and fittings. Sorry. So basically, get waterwise fixtures and fittings in homes. So that's something which, you know, we're working through with Watercorp. Watercorp are funding that one, so it's fantastic. But then there's a benefit, you know, if we're using less water, especially in these regional areas, then it's expensive to produce potable water there. So there's a win-win. Plus their corporate social responsibility, they're really embracing that. So they've been fantastic for us. And we're currently in the Midwest at the moment, changing out fixtures and fittings. So that's the toilet suites, the showers, the basin tapware, and that's where we have that support, you know, the educational material. So we did 1,000 properties in the Perth metro area over the past 2 years. That's seen a reduction in water use of by 40% and a 25% reduction in tenants' water bills. That's included because we go out and also test to see if there are water leaks. That's another big issue. You know, tenants, we've been encouraging them, if there's a leak, let us know, you don't get charged for it. And Watercorp will also say, look, you know, if there's a water leak and it's hidden, you can't see it and you get a massive bill, then you don't get charged for that if you're one of our tenants. So we're just making them aware that don't be afraid to report, it will come out and fix it. So, and it's a priority to do those. We're also working on waterwise landscaping projects, looking at a complex at the moment, which you'll see, and in the media probably in the next couple of months. We're really looking at creating biodiversity hotspots around the our properties, especially the bigger complexes where we have that opportunity, provide some nice and local plantings, endemic species where possible. And so Watercorp have been working through with us on that to create nicer environments, and these will be built into guidelines. So when we're doing the new builds, we can look at putting in appropriate planting there and things which are low maintenance as well. Well, there's a heap for us to consider, an absolute heap. So how do we hit net zero and even carbon negative? So we are looking, working with, we are looking at solar panels being more readily available, but how do we help and stabilise grids in these remote communities? We need healthy homes. We definitely need those. And you know, we're talking to various rating agencies, and I'll let you work out who they might be. You know, how do we reduce mold? There's the issue of mechanical ventilation is required if you're going to hit one particular rating. So what's the maintenance cost for that? They've said that we need to replace the filters every 6 months in those. So that's another consideration there. Build that into our maintenance program. So waste minimisation during construction, that's one of our actions in the Waste Avoidance Resource Recovery Strategy Action Plan. I can't believe how many times I've had to say that. So that we've got to look at reusing our waste construction demolition materials, and no gas. That's an easy one. There is people who still, and we'll talk to our tenants. Do you want us to convert your cooker over to all electric? No, I like the gas. I like the gas. You're not taking that away from me. So there's this whole education piece. Also, if you're going from an induction, from a gas hot plate up, you know, the upright cooker with the oven underneath, to if you want an induction one, and I would love one at my home, but it is prohibitively expensive for those. So that's a big issue if we've got the uprights. If it's just a hot plate on the bench, then it's a lot cheaper. Renewables, so that's the big one. You know, there's a lot of funding that have been announced federally, and we'd love to tap into that, and we're looking at that. We're working with Horizon and Synergy, but it does help if we own that, own the plant rather than Horizon or Synergy, because we can get more benefits directly to the tenants. If we get renewables, then, you know, we can look at our space heating policy. As you can see, as you've heard previously, if you put in air conditioning in the Kimberleys, $2 bills are, you know, they're not unheard of. So we've got to look at options there, and we don't want to set people up to fail, but we need people not to suffer from heat stroke. That leads into the cost of living. So if we can reduce people's water use through efficient water fixtures and fittings, great. If we can have renewables, fantastic. If people can't have, through the Synergy project, we've seen a number of homes which we can't put solar on, because, you know, trees are nearby and we don't want to be cutting down trees and creating a greater heat island effect. Or the roof pitches are all these, you know, they're being designed, they're squeezed onto a block and there's not enough roof plane for solar panels. So why did these people have to miss out? So we're looking at the potential solutions there, and design for those who live in the homes. But at the same time, we've got to be able to adapt to change. Some people move on, go to different areas, and if we've got a home which has been designed specifically for a particular need, will it be able to be adapted to another person's needs, or is it just a one-off thing? So we've got to really be smart about how we do things. So that's the big thing, is collaboration. That's how we're going to get towards this. We're going to keep working with, we're working across government with Waterwise and energy and all that sort of thing. There's getting some really good collaboration there through various government agencies, which wasn't probably present a few years ago. And we're being encouraged to do that. And we're looking at how we can help each other. And we're going to we collaborate with research organisations and not-for-profit sector. We can always collaborate more, and we're always open to it, and we need to continue to learn. It's a non-stop journey here. WA is really learning a lot in the difference on, you know, what people are now expecting in terms of the quality of their homes. People are more aware that their homes, and this is the regular off the plan homes, that they do cost a lot to heat and cool. They might not be designed for the climate in which people are living, and we need to listen. So we really do. That's one of the biggest things as well. We need to listen to our tenants. We need to listen to the people on the streets who want homes and want appropriate housing, and we need to action that, and that's something that we're trying with the new housing, the number of new builds that we're working through. And we need to lead. We need to take the risk for industry, and that's something that we're looking at. And you know, what new things can we do? What should be mainstream business as usual, and how do we get there with the building industry? So we take the risk reasonably. You know, we're not going to pay, you know, 5 times the amount for something, but look at taking that initial risk so we can help industry get there and make it business as usual. So with that, I'd just like to thank you for the time.
Okay, great. I've changed the times in my schedule, so now we're running on time. That's really good. I just it's magic. Anyway, the last speaker today is Paul Torzillo. He's a Professor Paul. There's a lot of professors here today, which is great. He's a physician and a director at Healthabitat. The majority of Healthabitat's work is called Fixing Houses for Better Health or Housing for Health. It's an evidence-based methodology founded on healthy living practices aimed at improving health through the living environment. And Paul's been involved in Healthabitat for, I think, well, it says here more than 25 years. It's a long time. The organisation works predominantly in remote and regional Aboriginal communities. And Paul, I'm going to hand to you. You there?
Okay, thanks, Kieran. Most of what I was going to say, I think, has been mentioned by other people, and I guess that's because a lot of stuff around homelessness and stuff around climate change is actually well known. The question is, what are we going to do about it? I'm going to just say a few things and then just show a few slides, maybe to give some slightly different data. If you take people who are homeless, there are studies in the US, the UK, and one Australian state all show that life expectancy, broadly speaking, for those populations is about 30 years less than it is for the rest of the population.
Hey, Paul, can I interrupt 1 sec? You're screen sharing, but we're just looking at your desktop. I don't know if you're meant to have a slide up or not yet.
I haven't got a slide on it yet, but I'll...
I'm happy to keep looking at your web browser, but I just wanted to let you know that we're not looking at a slide.
Okay.
Oh, God.
I might get Heather to just run my slides when I get to that point, if that's okay.
Okay. Heather, can you do that? Yeah, if you stop sharing, we can run the slides.
Okay, great. It's sort of interesting because that means that the life expectancy of homeless people as a group is much worse than it is just for Indigenous Australians as a group, which we all think is a pretty big deal. Homeless people have higher death rates, they have higher hospitalisation rates, they have higher rates of disability and higher rates of chronic disease levels, as well as higher rates of serious mental health problems. It's important because health problems can be a driver to being homeless, and being homeless can be a driver to health problems. So those people go round and round in a circle with their health getting worse and worse. There's a study from Perth, from your state, in 2016 that showed that 80% of homeless people had significant mental health or alcohol-related or physical health problems. There's some ABS, Australian Bureau of Statistics, data from 2016, which demonstrates that 20% of homeless people are Aboriginal. But like most of the generic nationwide ABS data on social and health characteristics of Aborigines, these broad numbers often grossly underestimate the size of the problem in particular regions. And that's true certainly in most remote regions and lots of regional areas. Homeless people have little access to primary care to manage their chronic health problems. And this matters because in 2022, treating heart failure and treating high blood pressure and treating kidney disease and treating diabetes and using medication actually makes a difference. That's called secondary prevention. And there's huge high quality data which shows that stops people dying from these diseases. So if you can't access primary health care, and if you don't have anywhere to store medication, you can't keep it, then you're not going to be able to access that secondary prevention and treatment, which a huge hunk of the population do. And that's going to be one of the reasons your mortality rates are higher. So lots of this increased death rate is preventable. Most homeless Aboriginal people move in with family of one sort or another, and that puts further stress on the health hardware in the house, which I'll talk about in a minute, and it makes thermal control in housing much more difficult, and I'll come back to that with a few slides. Climate change itself has obviously got multiple potential effects on health. Rising temperatures is one of them, but it's one of the most important. There's a measure called the Heat Exposure Vulnerability Index, which a lot of international organisations use for global comparisons. And Australia actually runs significantly higher than the global average. And in Australia, there's an upward trend for this index. And so although we call ourselves a lucky country, this probably isn't going to be true for climate change, and certainly not for particular populations. If you look at the international literature, it'll tell you that heat stress is most significant for people over 65 or less than 1 year old. But because of the different underlying health characteristics in Aboriginal communities, the at-risk groups for this mob are probably much wider. The age groups are much wider that will be at risk. And it's because of their existing comorbidities, especially heart disease and diabetes and renal disease and chronic lung disease. All of these conditions are higher in Aboriginal people than non-Aboriginal. And for many of them, they're not just a bit higher, they're a huge amount higher. So for some age categories, in serious end-stage renal disease will be a couple of orders of magnitude greater than they are for non-Aboriginal Australians. So the differences in underlying disease state really matters. The third sort of category of people at risk from heat stress are, again, the population of homeless, vulnerable, poor, disadvantaged. And very often the reason they're at such risk is they don't have resources to mitigate these high temperatures. And you've heard a lot from earlier speakers around that today. There's a lot of international studies which demonstrate that increased temperatures lead to increased deaths from heart attacks, from respiratory disease and from renal disease. Again, all conditions which are much more common in Aboriginal people. You've heard a little bit about the cost of power supply in remote communities. And in many communities across the country, there's now a pay-as-you-go system for power. And when you go to many of these communities now, especially where these systems have recently been introduced, you'll find substantial numbers of houses in communities where there is no power supply. So issues of heating and cooling don't get a Guernsey because there's no power. Storing food doesn't get a Guernsey because there's no power. It's sort of important because this pay-as-you-go for power is generally justified on the basis that if you make people pay, and I've had someone from the Commonwealth tell me this recently, they will then change their behaviour and they will appreciate their power and then they will pay for it. I guess there's a couple of things about that rationalisation. The first is, of course, it doesn't work. And the second reason is that educating people who don't have resources to pay isn't going to allow them to pay any better than when you started. So if we wanted a government action which would have an immediate impact on the issue of thermal control in communities, it'd be getting rid of pay for power in these places. I'll just briefly come back to the issue of homelessness in remote communities. I think you can see my screen now. This slide,
Paul, I'm going to share for you, Paul, okay?
Okay. In the last 25 years or so, we've been doing what we call survey fix projects in Aboriginal communities right across the country. And these are some data, 255 projects, nearly 10,000 Aboriginal houses and about 60,000 people accommodated. And if you look at the next slide, what that'll show you is that in these communities, in these houses, if you look at what we call the hardware, do they have electrical safety? Can you have a shower? Can you store and prepare and cook food? All those things underperform. So we got electrical safety in about 9% of those houses. You can have a working shower in about a third of them. You can do something to fix that if you put in fixed programs, but that's what happens when you walk into houses. And interestingly, at least in the last couple of decades, despite doing projects over a long period of time, we haven't seen those numbers shift much. So these sorts of basic performance of health hardware in houses have stayed pretty stable. So that's the situation that Aboriginal families will be living in when their relatives move in because their relatives are homeless. If you just go to the next slide, you've already seen this graph looking at climate zones across the country. And Tess Lee, who's done a lot of work in Aboriginal communities and housing and on climate, led a group of people who looked at sustainable housing and also trying to look at the impact of temperature and climate change problems in the future. And so as part of that work, if you look at the next slide, these are just some data. Again, you've seen some stuff like this. There are 4 boxes, November, December, January, February, going along the x-axis 2000 to 2020, and down the y-axis you see a whole lot of communities in regional and remote areas. And what that shows is one of the slides you saw from Petra early this morning. Things are hot in these places and they're getting hotter. If you look at the next slide, there was some simulation work done in this project, taking current standard Aboriginal houses and also looking at improved, in inverted commas, construction models, and then looking at a number of variables. What was the occupancy of the house? What was the ventilation? Was air conditioning present, absent? Where was it placed? Looked at energy consumption, looked at the climate zone, and looked at the temperature range across the current year, and then looking just at a very modest 1.5 centimetre global warming. If you look at the next slide, we put all these factors into 366 simulations. You can look at the detailed results of this in an Ahuri report, which is indicated on that slide. But essentially what this showed is what you've been told through the day. Aboriginal housing at the moment can't control temperature in a way which is going to prevent health damage for the occupants. And when homeless people move into houses and increase the occupancy numbers, then thermal control gets even harder and the stress on the hardware in the homes gets even higher. So that current housing is not going to do this, and future housing, even improved models, is not going to protect these communities from increasing temperatures. And the problems about thermal control, energy supply for that, energy costs, and their living circumstances is going to make living in these communities tougher and tougher. And it's hard to see how they're going to survive. I was just going to make one other comment, which is there's been a bit of discussion around education for health or behaviour change as something that's important. And I just want to say over, you know, a quarter of a century, that hasn't been my experience in Aboriginal health at all. I haven't seen any education for behaviour change programs that have actually worked. And if you look internationally, they don't work in populations in poverty or who are suffering the sort of stress we're talking about. And one of the reasons they don't work is there's often very powerful drivers for these behaviours, and these behaviours are actually often well adapted to the sort of lifestyle people need to have to survive. So that's a throwaway comment. I'll finish there, Kieran.
Makes thermal control worse, no matter the design and no matter the level of achievement of star ratings or any of those things. Attention must be paid, therefore, because the failure to do so risks a situation of defaulting to climate migration as the de facto housing policy in the north. And that, I think, is a big issue facing Aboriginal communities being pushed, in a sense, off country as a result of this climate change. So I would encourage you to read the report. It's a fantastic piece of work. Right, so we're going to get into the second part of this session, workshop 2. I'm going to hand back to Lana, and there's a couple of questions. Lana, we're going to have to wrap it up before 4 o'clock, if that's okay. 3:57 on my notes, if that's possible. And so that I have enough time to say the 3 sentences I have at the end. Thank you.
Okay. That's my brief. We're going to keep the energy up. I realise that this has been, 3 hours of listening and thinking, but let's capture your expertise for the last part of this workshop. So for those people who are in the room, you've got the questions in front of you. So obviously this time we're talking about social housing stock rather than people who are experiencing homelessness. So there's 2 key questions for you. The first one is looking at what are the key barriers, and I know there's a lot, and Paul's laughing here at me. And then the second question is about what are our priority actions and or solutions moving forward. Now for this workshop, I think I don't want to end up with a whiteboard full of all the priorities and all the actions and solutions. So I want you to do a bit of prioritising, please, and obviously the same for people online. So I'm going to restrict you. I'm going to ask you to come up with 2 of the most key pressing barriers and the 2 most significant, most important priority actions or solutions moving forward. So in your 10 minutes, I want you to have the conversation, but just come up with 2 of the key barriers. So we've had 3 fabulous speakers, but you've got your own expertise to draw on as well. Let's do some prioritising. Let's help Shelter WA come up with the list of what this group, this consultation, sees as the 2 most key barriers and the 2 most key priorities or solutions moving forward. So it is 3:25. You've got 10 minutes to come up with these 4 points. So I'll call you together again at 3:25. Go, go, go. Okay, I'm going to interrupt your conversations. You know, as a facilitator, this is the thing that I often share with people as the worst thing. You have highly engaged groups of people involved in intense conversations, and you have to say, stop. So I'm sorry, but we do have a really tight timeline, so we need to move on. This time I'm going to ask our online people to share their views first. If you remember, my task of you was not to come up with a whole list of priorities, because our speakers have shared a lot of those as well as a lot of the solutions. I wanted you to do some prioritising. So if you were the Premier or the Prime Minister or the lead in this sector or this issue, and you were asked for the 2 key barriers and then the 2 key solutions, what would you say? So, daughter, I'm going to go to you first, please. Could you share your key barriers that your group has identified? Oh, she's coming. Wait, okay, Mel, can we go to you?
Yeah, sure. We actually did more than 2 because we thought we might go towards the end. So now I have to choose them. But the big one really that stood out, key barriers for improving, is learning from mistakes. So let's not rebuild the same sort of housing, especially in an area that's known to flooding or fire.
That's beautiful.
And another one was behavioural change, such as education. The decision maker, the people making these decisions, what's their background, and are they up to date with this sort of information? And also the cohort that's in social housing, what's provided to them to support them through getting out of this situation.
You've given me 3.
Sorry. Yeah, I'm going to stop.
Can we just go back to 2, because I just need to understand clearly what you were suggesting there. So you were saying the decision makers need to be across all of the information and all of the data, and one of the barriers that they are not currently. Is that what you're suggesting?
The person who mentioned it came from lived experience, and they said even for that person, they would have preferred more of education for those appropriate behavioural changes. But then she also looks at the people making these decisions on her behalf, and we're like, you may not necessarily know the experience that I'm going through to be that best judge of character to put me in that position. Yeah.
Okay, beautiful. All right. So is daughter back online, or are we still waiting for her?
Yep. No, I'm back.
You're back. Beautiful.
Yes. Sorry.
Okay. So what were your key 2 barriers? What were the 2 issues that you identified as most key?
So I think I missed what Mel said there, but I think she said something about educating.
So she said that the 2 key barriers, and in fact, it's really almost the solutions, isn't it? We need to learn from our mistakes, was her first point. And then her second point was about that, certainly from the experience of people who are the lived experienced voice, that they're saying sometimes the decision makers are not as fully informed as they could be.
Yeah, so that reflects a lot of one of the points that we would have made about so we actually said, there needed to be some some education through some of those departments and understanding of regional and remote issues.
Right. So particularly for our regional differences.
Yeah, regional and cultural differences.
Regional and cultural differences. Beautiful. Fabulous.
And also ageing. So making sure that the housing stock is suitable for long term, so to accommodate people as they age. So making sure the door frames are wide enough, for example.
Oh, right. So you're talking about the ageing population rather than the ageing of the houses.
Yeah.
Okay, long-term planning for ageing population. And the fact if I reflect on my session with the lived experienced people, was reflecting that our ageing population means that the rates of disability will increase and that the housing stock needs to reflect that.
Yeah, very much. I think that's really important.
Yeah, excellent. Okay, beautiful. So can I move to the in the room groups? Sorry. Fabulous. Okay, your two key barriers. I think you need to be turned on. Yeah.
It's not me, it's them. Royston. Oh, here we go. Okay, well, of course, we had struggled to get to 2.
No, of course, that's always the challenge.
Okay, well, let's go for a lack of a baseline assessment is a barrier of assets and gaps. So we figured that's probably a solution as well.
Yes.
And then, okay.
So can I just check what you're talking about here is that we're not clear about the housing stock across the board in terms of the appropriateness of the design, right,
what we've got,
yeah,
and
what
then what we need.
Right.
So we need to be clear about that, and that's the regional. I think someone mentioned that across the region.
I'm looking at Dave. Yes.
Yeah. Okay. And then then there's between the next 2. Well, we'll say this one. There was a lot of discussion around the general low commitment to utilising the community in their experience and involvement in identifying the problem, but also resolving it. So helping them, help involve them in. Is that right?
Around remote maintenance and communities, especially.
Okay, you just need to talk
more. Engaging the community more in the addressing the problems.
So that's probably a solution, but what you're saying is the barrier is that we are not engaging community enough.
That's what we're saying.
Is that what you're saying?
Yeah, lack of commitment.
Yep.
Well, the sort of barrier is that in terms of remote maintenance and what we're looking at in terms of like what Paul was talking about, some of the issues around remote maintenance and sort of the bureaucratization of that, and not utilizing people in community to repair those things, and sort of all of the funding and money that gets lost in terms of transport and things going out to tender, as opposed to mentorships, apprenticeships, job creation for people in community, which would not only give people a sense of empowerment and self-determination, but also work on that closing the gap in a lot of other areas.
And also getting the work done perhaps more quickly and efficiently.
Well, and we all know that whenever someone takes part in creating change or improvements, they take more pride in their house and that sense of ownership. And so the benefits of that, and people know their own homes, they know the cracks, they know where those air conditioners should sit as opposed to in windows. They should be on walls, and then we have fresh air, and then we know what's wrong in our houses. And when people in community are empowered to fix them themselves, it would not only save dollars, but it would actually create a different sense of
community. Absolutely. Can I share with you, and this is really off track, but I work in the palliative care sector, and we have a movement called the Compassionate Communities Movement, which really is exactly what you're talking about. It's recognising that people want to die in community, that they need the people around them to support them. It's not something that's done by service providers out there. It's something that happens within and by and for community.
Well, and this is all of that talk that we're having, the conversation we're having around lived experience, self-determination.
Absolutely.
I mean, everything we know that we're supposed to be working toward.
Absolutely.
Empowerment, all those things.
Fabulous. Thank you. Yeah.
I'd just like to mention there's one group that actually works up north. He's located here. His name's Mark Anderson. He's the CEO of Fish Foundation. Now they actually run programs where the person who wants to purchase a property, they put in their own work of hours of studying, 200 hours, I think it is, and they actually help build these houses for them.
Yeah.
And if you look on LinkedIn, if anyone wants to Google fish on LinkedIn, you'll see the amazing work that they have done and supplied fish. Foundation
FISH.
Yep. Foundation of Indigenous Sustainable Housing. Yeah, I take my hat off to Mark for what he's done for our Indigenous community. I know I'm going to be bringing him. I'm bringing him.
Okay, so while you've got the microphone, who from this table is reporting on what you think is the key barriers?
Well, we thought that there might be a lack of political will to go to the scale that we need in the time we need, and that led to the lack of government funding. And we also thought a lack of awareness. So if more people knew of tenants' lived experiences, and also the way the system is pretty stupid, there might be more movement. So that could be a really big barrier we could get over.
So a lack of political will and funding and lack of awareness. Beauty. Okay, the last table here, we seem to be losing people, so we need to move quickly.
So we
10 minutes.
echo
Beautiful.
what they said, political will, and the first thing that was written down was it's too big, it's too hard kind of thinking.
Yep.
And then echo, lack of communication and inclusion of the people living in the home.
Yep.
That closed-mindedness about other people's perspectives, that we're all in this together and we each have an expertise to bring to the table. So
Yep.
making sure that, I'm going to solutions. Yeah.
Yeah.
Making
Well, in fact, and that's really interesting, isn't it? Because you look at the key barriers and then that helps you identify the key solutions, doesn't it? Yep, absolutely. Okay, moving forward, daughter, are you still online?
Yes,
she is.
Yeah,
Okay,
sorry.
what were your two key solutions?
So actually our key solution was around the maintenance contracts as well. So we were making sure, so talking about the commissioning of the maintenance contracts and reviewing that process and making sure that there was some sort of locally driven upskilling of locals, but also enabling locals to participate in that, so that it's not, someone from Queensland that has to fly in. Once there's a log of 10 actions that have to be taken, they won't come out for one, and then by the time those 10 are there, it's a much bigger problem and everything's gotten worse, and it all escalates. So making sure that locals can actually participate in that process.
Yep. And number two?
And the other one was thinking about consultation and upskilling with consultation with people in social housing in terms of some of those solutions for culturally appropriate housing, housing suitable for aging and suitable for the region. So like making sure you're getting that input from locals, because they're all different depending on where they live and what they need.
And if I can reflect on the lived experience session that we had a couple of weeks ago, the members there were saying we need an organisation, we need a formal mechanism by which our voices can be heard. So fabulous that Shelter WA ran a consultation. That's, fabulous. But the members of that group were saying we need our voice to be heard consistently and concertedly. So well done them.
I think too, sorry, there was a really good program, I can't remember the name of it, from Queensland, where they did like a good tenancy upskilling program for people who'd had some issues. And it was such an effective program. It really changed the outcomes the outcomes for the tenants in terms of just their understanding of how to be a good tenant as well. So programs like that as well, we've got buy-in from both tenants and people that are renting out houses.
Yeah, and it goes back to sorry, I don't know your name, the woman on this table next to Michael, who was talking about the critical importance of empowerment. That informing, working with, giving people a voice, upskilling them is absolutely the way to go. No, you can't. In a minute. Okay, thank you so much. Now, have we heard from both Dorte and Mel? No, we haven't heard from Mel in terms of priority actions.
I'll quickly just let you know our priorities, actions. So just 2 of them. So raise standards across the board, such as with building codes, like how to build a house properly in the first place, with good thermal and passive solar design.
So did you say at the beginning, good standards, good building
raise standards.
Raise the standards.
Yeah,
right.
Yeah. Do it properly from the beginning sort of thing.
Yep.
And the second one was not a one shoe fits all. So specific consultation on each different environment throughout WA to create appropriate solutions to building houses. So up north's vastly different from down south.
Yep.
Yeah.
Yeah, and that was Dave's very key message that, you know, WA is a really big state. And how many climate zones were there? 5. Yeah, so that's, critically important. Fabulous. Thank you, Mel. Going to the people in the room. Michael, your table, what's your... Now, you haven't got a microphone. Not quite, Sarah.
Okay. Oh, right. Okay. Well, we did have some solutions in that first lot, but one of the things we came up was the need to develop, need to prepare preparing for multiple climate stressors at the same time, which is part of that earlier plan.
So that's the heat, the wet, the cold, is that what you were?
Yeah, the rain, the wind.
Yep. Humidity.
So we're assessing that right across the state.
Yeah.
Okay.
And because different strategies are required for different stresses. Yes, absolutely.
And
so it's multifactorial. Yep.
So multiple climate stresses at the same time, and develop adequate climate-proof standards for public housing. So that was our person here from the expert on climate.
So does that fit with number 3? So
probably yes, adequate climate-proof standards.
So the comment from, I think that was from Mel, was about raising the standard of builds.
Yeah.
So do we get another one?
Yeah.
You do, Michael.
Well, I would add resourcing to the community housing sector, particularly for assets, public owned assets managed by community housing.
All right.
So just understanding what you're saying, Michael, so you're just saying more resources to the social housing sector?
Well, the point is that for community housing, particularly for people exiting homelessness, we can barely make ends meet to run community housing. If those assets belong to the state, then they should be resourcing, addressing those issues.
Yep, absolutely. Okay, this table here. What were your 2 priorities?
Hello, so we thought funding for native title that's been awarded recently could be used for housing quite urgently. And this is a bit cheeky, but I'm just channeling the vibe.
Just let me get this down. So native title funding being reallocated to housing for First Nation people.
For First Nations people experiencing homelessness.
Yep.
In Swalce and in Yamaji country.
Yep.
And then there could be a potential for tenants to take the government to court for the lack of climate appropriate housing, and perhaps KCLC have a test case.
Oh, we've got a radical in our midst.
But less radically supporting people like Dave to show leadership in the government with minimum standards for social housing.
Yep. So you've got a room of advocates here for you. Look, he's looking really embarrassed. Sorry, Jane. Okay, this last table.
Marina, you want to talk, Marina?
Oh, yeah.
Oh, yeah.
Okay, 2 actions, Marina. Only 2.
Only 2.
Yes.
That and that. Yeah. Okay. That interviews with people in Department of Housing, Communities and community houses to see what their priorities are. Consult with us.
Yes.
Yes.
So this is the critical role of lived experience.
Yeah. Consult with the people who are actually in the
Yep.
houses to see what they need.
Yep.
And actually listen.
Yep.
And then, I'll give it to Dave.
Okay, look at the easy things to do, like insulation, LED lights, ceiling fans, water-wise, weatherproofing, weather seals, and energy efficiency.
All right, so can I just have a couple of those again?
Insulation.
Insulation. Yep.
Energy efficient.
Energy
Water-wise.
efficiency, etc. And you're saying quick wins?
Not expensive.
Not expensive, right? Yeah.
Can I just link those two together? Because if you actually asked us who are living in the actual houses, what would make this like, or, you know, maybe there needs to be education around for people, like if we don't understand the impacts of climate and energy in our own properties, but actually aren't like, so my property, like seals on the windows would be a really quick win for energy efficiency.
Yep.
Insulation might be a waste of money in my property.
Yep.
Like, so, you know, there's mechanisms and those little trackers that like track what is smart meters, like that sort of stuff, so that you can actually do bespoke, like easy wins for individual properties of what that actual property needs and what's the priority for the person in the property.
Yep.
Can I just?
No, Marie.
Well, I've got the mic. I'll just quickly say, it's like, for example, I'm in Department of Communities and I know that people have left and they're now refurbishing the apartment of the people that's left. So I don't know whether now that they're being refurbished, are they refurbishing them?
Considering
putting all those things in.
And Dave would say we're trying our best. No, maybe, yeah, look, okay, let's not go there just for the moment. Okay.
But I'm just saying,
yep.
As the places come up, that need refurbishing.
Yep, absolutely. Look at the quick, easy wins, listen to you guys and your experience. Recognise there's not a one size fits all, understand the multitude, the complexity of the climate stresses, the heat through to the cold, through to the rain, humidity, that we need to properly resource the community social housing sector, can be innovative, consider native title funding, be radical and take legal action. Okay, I've gone over time. Humble apologies. I did my best. Thank you so much, everybody. Please let us take the sheets and the writing away. For those people who are online, if you haven't had your thoughts heard, please write them down, take a photo, email Shelter WA. We want your input as much as we possibly can. Thank you. I'm finished.
Thank you, Lana. Let's give Lana a small round of applause, very large one, I mean. So thank you very much. I agree. Suing always works. Ask people at Santa Teresa. They did a great job, and it was one of the only times the NT government got its act together and started sorting some of that remote maintenance out. So it's been a great discussion. Thank you very much for attending in person and online, to the people online. There's been some wonderful contributions. We're going to compile all of this and develop a communique, and we'll make it available as soon as we can. Some poor shelter person now has that on their to-do list for next week. So sorry, is that Chantel? Yep, well done, great. So it concludes the session for today. In about 30 minutes, we're holding a networking event, and you can see that Michelle is doing some songs later. The keyboard has arrived. You're obviously welcome to stay for a drink, listen to the tinkly tunes of Michelle Mackenzie as she bangs it out. And she'll be joined, with a bung shoulder. She'll be joined by the wonderful St. Pat's Choir, who are really the stars of the show. In between now and then, in that sort of 30 minutes, you're more than welcome to stay. We're going to be sort of resetting the room slightly, but don't leave the building, if you're intending to leave now, unless you head into that room. See where Elise is standing. She's now beckoning through she's standing next to between the carry and the marry, and you enter via marry. There's a project that's being run. Where's Deb? Oh, there she is. And Deb can explain this in much more detail, but it involves you, your foot, your shoe, and clay. And we would love for all of the people who are here today to participate in that project. Thanks again to Lana and all of our speakers, and to the fabulous Shelter WA staff for pressing all the buttons and running around and doing all those things. Well done. Homelessness Week. It's a frenzy of fun activity. Thank you again. We're going to wrap things up, and please put your feet in some clay over there. Thank you.